Good morning, everyone. Welcome. My name is Joan Batorf, and I am a professor here in the School of Nursing at UBC Okanagan and director of the Institute for Healthy Living and Chronic Disease Prevention. I'm delighted to have you all join us this morning. But before we begin, I want to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation and their people. And it's a really lovely sunny day today, I have to admit. It's hard to stay inside. I would also like to acknowledge that some of you might be joining us today from other places, both near and far. And I want to also take a moment to acknowledge the traditional owners and caretakers of those lands as well. So before we begin today, just a bit of housekeeping. You will find a closed captioning box on your screen, and you can move that around. Or if you choose to close off the captioning, you can do that with the live transcript button on your menu bar. We welcome you to type in questions or comments into the chat box during the presentation at any time, and we will read them out and have a discussion about the presentation towards the end. So do jot down those questions and comments. We'd love to hear from you. So today's webinar is brought to you by the Institute for Healthy Living and Chronic Disease Prevention here at UBC Okanagan. And I'm delighted to welcome our speakers today. First off, my colleague, Dr. Lise Olsen, who's an associate professor in the School of Nursing here at UBC Okanagan, who is leading this research that she's going to share today. And we're also delighted to have two of our UBCO students joining us in this presentation, Paige Dafoe and Rebecca Anderson, both who are in their 5th year of their BA in psychology programs and about to graduate in a month. And both of them have been working with Dr. Olsen, supported by a program called MRF here on campus, which provides undergraduate students with the opportunity to get some research experience. So with that, I'm going to turn it over to Dr. Olsen to begin our presentation. Welcome.
Thank you so much. Thank you very much for the introduction, Joan, and thank you to Rebecca and Paige for joining today in the presentation as well. Today I'll be talking about a project that we have currently underway regarding designing web-based resources to support inclusive and safe recreation participation for families and children with autism. I would also like to acknowledge the opportunity we have to work in this lovely area on the unceded territory of the Syilx Okanagan peoples. And some of our collaborators and project members are working elsewhere, particularly those that are working in the Lower Mainland. So that land is the unceded territory of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations, and would like to very much gratefully acknowledge the opportunity to work and gather there as well. So just to start off, I'd like to provide a little bit of background information around autism among children and youth. In Canada, the rate of autism diagnosis is growing. So currently 1 in 66 children are diagnosed, with boys being 5 to 1 times more likely to be diagnosed than girls. Physical activity, which is the focus of this presentation and this project, holds many benefits for children with neurodevelopmental disorders, including autism, and physical fitness, health, social benefits. But children with neurodiversity often have fewer opportunities to participate in recreational opportunities than their typically developing peers. There are a number of different barriers that can impact their participation in recreation, and safety-related barriers do play an important role for children with autism. There's been higher rates of injury found for children with autism than their typically developing peers, particularly for certain types of injuries. For example, drowning is one where there is a higher rate. And wandering and elopement is a high-risk behavior. It's also called bolting, or it's a situation where children may just dart off or take off unexpectedly. And that can present a high risk for children who might encounter traffic situations, or as we know, there's a lot of open water in BC and in the Okanagan in particular, and that can be a high-risk situation for children if they encounter a body of water and they are without supervision. So wandering and elopement is estimated to affect 30 to 37% of children with autism. So it does present a risk, a risk behavior that can be a barrier for parents and caregivers feeling confident to allow their children to, or encouraging their children to take part in recreation activities. So we have done some previous studies, some qualitative work, mostly identifying barriers that parents do face in helping their children be active. And this work highlighted that parents expressed a need for easy to access resources so that they could find some assistance and some guidance as to how best to support their children in recreational activities. One particular issue that was raised is that parents often have safety concerns related to their perception that there's a lack of support for their children in community recreation programs. And this was more pronounced when communities were smaller and people were living outside of the bigger city centers that tended to have more community recreation supports in place. So that's a little bit about the context and the background for this study. What we're aiming to do through this study is to develop a website to help address some of those resource needs that parents have expressed. So our study aim is to develop and test the feasibility and effectiveness of an online educational website that can provide parents of children with autism with a resource to help increase their knowledge related to how they can support their kids in sport and recreation activities, to identify possible strategies they can use, and to learn about community resources. So in terms of what we've done to date to move this plan along, this has included engaging with community partners or community groups, parents, and also service providers, that should say there. We've conducted and are still conducting an online survey to assess, before we begin the design of the website, what the end user perspectives and preferences are consist of. We've been working on some literature reviews to support the content development for the website in terms of particular sport topics and particular topics that we're developing evidence-based information about. And then also an environmental scan around the current web resources that are out there already that parents and providers can take a look at. So in terms of our results to date, we have a community advisory committee that has been formed and has met several times and includes members with lived experience of autism, and as well as parenting a child with autism. And they've helped to inform different aspects of the project, such as the questions for the survey and such things. We've also conducted an environmental scan of the resources that are out there. So looking to see what safety related websites currently exist, and we identified 27 autism related resource websites in North America that are operational currently, and only 6 of those had safety related information on them. So it's not that easy to find safety related resources, and 2 that pop up and that you can quite easily access are from 2 of the larger autism organizations, one being the National Autism Association in the US that have developed the Big Red Safety Box, and that's a resource that they will send out to community groups and to families that provide some resources around, mainly around child identification, how to be able to identify your child if they get lost, or resources to help inform first responders about autism, and some different tools and checklists and things that people can access. Autism Speaks is a US-based organization that also has Canadian branches. And so they also have some resources online available. And those are really, I know it's a little hard to see in the small font there, but there are about creating safety plans, asking for help, using public restrooms, interacting with law enforcement. So not so much recreation based, but rather when children, helping families kind of navigate just being out in the community and helping children interact safely with other members of the community. So there are some resources available, not a lot, and those that are not necessarily specific to recreation participation. So moving then into the survey that we have launched and are gathering information about. This online survey has been implemented using UBC Qualtrics, and it has been sent out through various community-based organizations that work with families with autism. And we so far have 23 responses, which have been very helpful and valuable. So 8 parents have responded and 15 service providers. Our survey is still open, so we are hoping to gather a few more, but we'd like to use this information to make some of the initial decisions about structuring and designing the website. So just to give you a little taste of what some of these preliminary findings look like at this point, about 3/4 of the respondents considered their community to be urban, and all the respondents indicated they had internet access at home. And in terms of accessing autism-related websites, so far about 80% of the providers who responded reported accessing these kinds of websites several times a month or more frequently, whereas only 38% of the parents indicated this. So, you know, granted, this is a pretty small sample size, so we'll be continuing to look at those differences to see if they stay the same as more respondents fill up the survey. But I think, you know, it makes a little bit of sense in that service providers may be using various websites to inform their work and their practice, and maybe utilizing this information a little more frequently than parents. And then we had some good representation so far from various parts of BC, with most respondents from the Thompson Okanagan area, followed by the Lower Mainland, and then Vancouver Island and the coastal regions. So that was nice to see some response, and a little bit, and a small number from the Cariboo. So it was nice to see various geographic areas represented. And one of the main questions then of the survey relates to what safety topics do parents and providers consider to be the most important? So it's really going to inform, because there's many different sport and recreation topics that would be possible to cover. So we really want to focus on the ones that are seen as the most relevant for families. So the top one so far has come in at swimming and water safety. And I think given the amount of open water and access to water that we have here in British Columbia, that makes a lot of sense. And this survey is focused on families from BC. And then the next highest rated was traffic and pedestrian. So that's not exactly a sport and rec activity in itself, but it certainly impacts many recreation activities. If children are out in the community, if they're on their bikes, if they're playing in playgrounds or many different things, they may come in contact with traffic situations, and that plays a role in how safely they can navigate that. And then the next ones relate more to interaction. So how safe, so we have safe play with other children and safe interactions with adults. And those both rated quite highly as well in terms of the mean scores of how important it was for parents or providers, how important they considered this content to be addressed on the website. And so that is more that kind of social aspect of how can we help children and families foster safe play and safe interactions, both with other kids and with adults who might be part of the sport and rec activity. Next, we have cycling, and then team sports, safe team sports, as well as camping and hiking. So those were the top ones. The ones that didn't make this list were ones were included playground safety, play in and around the home, play outside in the yard, which were types of recreation, activity, and play that perhaps parents felt like they had more ability to control or supervise and were not as concerned about. So these were the top topic areas that respondents thought were important to address on the website. So there's also a few other questions that I just wanted to highlight. One was, we asked people how important different items, to rate different items in terms of their importance to include around accessing safe environments. And the number one answer there was having access to supervisors and coaches who had safety related training. So that was the number one answer for safe environments. Another question addressed behavioral management issues. So what were the most important behaviors that respondents felt it was important to address? And those came back with the top ones being management of aggressive behaviors, wandering and bolting behaviors, and self-injury behaviors. Next, we moved into a little bit more about, just to back up. So those gave us some ideas around content, behavioral content, and sports-specific content, and what kinds of content areas we might want to focus on with the website. And then around the design of the website itself, participants rated having reliable and trustworthy information as the top priority, along with ease of navigation between pages and having well-organized pages. And then lastly, preferred formats. The number one preferred format was having links to other ASD organizations included, having videos showing child and family experiences, and having blogs with child and family experiences. So we thought that's quite interesting to really see that when people are thinking about a website and what they want to access on that website, that being able to see what other families have been experiencing is really important, and doing that through videos and blogs is also seen as a priority. So interestingly, like having links to chat rooms and social media was not rated as high. So we'll be carrying on this survey. We'll be having it open for another week or two, and then we'll use that information to base some of our decisions on around website design and topics and organization. So just to, currently we have the responses that we have, and we're hoping that those will be a little bit, we'd love to have a little bit higher response rate before we cut the survey off and use the information that we have. So that's some of the building blocks for the survey, and some of the ways that end user information is going to help us create the design and the outline and the components. So from that, I'd like to move a little bit into sort of the content areas that we are also developing based on some of the lit review work that we've been doing. So one lit review, I'll talk about this one first, and then I'll turn it over to the students, Rebecca and Paige, who will tell you a little bit about the literature work that they've been summarizing over some of the past months as part of their work. So one area of focus that we've looked at is around the issue of elopement, and it's also called bolting, and this behavior and how parents experience it and what strategies they use to manage it. So for this, we conducted a scoping review of the literature and identified a number of abstracts and articles. And when we kind of whittled it down to the studies that met our criteria, there were just 8 studies that met our inclusion criteria. And there was 2 qualitative studies, and the rest were quantitative, with one being experimental. Most of the studies were surveys to find out how big an issue bolting or elopement was, or wandering is for families, and what they typically, the kinds of strategies they typically use. It's kind of interesting to look at this literature because there is more literature in the area of elderly persons and with dementia, for example, and wandering. But for children, there's not nearly as much. So it is an area where not that much research exists, but it is an important topic because it does affect many families, and it does have an impact on whether parents feel confident in letting their children or supporting their children in recreational activities if they feel like it's a danger for their child to perhaps take off during that or run off during that recreational experience. So what this research showed was that there's a variety of interventions that have been used and that parents report using. And these include things like physical or environmental barriers. So having locks on doors, having alarms set up, having fencing around recreational sites, so that children are essentially, there's an alarm if they try and leave or they're actually blocked from leaving. There's also evidence that electronic trackers are used in some cases, or personal safety equipment such as harnesses. And then other strategies are more around kind of educating the child and the family and those around them to help prevent this behavior. So school individualized education plans is one strategy that's reported, as well as therapeutic approaches. So a very popular or common type of therapy being applied behavior analysis, or ABA, can be used to help teach the child to interact differently with their environment so that they are less prone to running off and eloping. And then lastly, community awareness. So this was a strategy of, just around letting others in the community, letting neighbors know that perhaps their child was a flight risk, and to keep an eye out for them if they saw them leaving the yard or something like that. So there's lots of different strategies that are possible at different levels, but like I mentioned, it's an area where there just isn't very much research, and there isn't any intervention research that has looked carefully at which of these interventions are most effective. This is really just a sense of, well, what's out there and what are people currently using. So that is a summary of the elopement content, and we hope to build some of this to include on the website so that people can have our users can have a sense of this issue and some possible prevention strategies, what those might look like. So I'll turn it over to Rebecca now, who's going to give you a bit of an overview of some of the work that her and Paige have been doing around a couple of other recreation topics. So thanks, Rebecca.
Thank you, Lise. So Paige and I have been conducting more literature reviews on just more sport-focused topics to include on the website pages themselves. So far we've looked at safe swimming and water activities, as well as outdoor activities like hiking and camping. For these, we looked at peer-reviewed academic sources and reputable gray literature that was found through databases such as PsycInfo, CINAHL, and Google Scholar. We used the key terms: water safety, autism spectrum disorder, swimming, hiking, camping, outdoor recreation, adaptive recreation, and active play. Thank you. So far we found that outdoor activities are very beneficial for children's development, especially those with autism spectrum disorder. So we've seen that these outdoor experiences can actually increase outdoor skills, socialization with peers, and satisfaction. So some of these preferred outdoor activities were shown to be ones with sensory elements, which included jumping, running, climbing, swimming, swinging, and sliding. We've also taken a look at risky or free play, which is where you allow your child to have free play by itself that can include challenging, exciting, and potentially harmful behavior. And it's shown to benefit children, including those with autism, and it can actually decrease the risk of injury because this allows children to have those independent experiences and form their own boundaries of where they feel unsafe or safe. While these outdoor activities can be very beneficial, there are risks associated with them still. So it's important to look at minimizing hazards in the area, as well as supporting each child's individual abilities. Next slide, please. Thank you. So then I looked at hiking and camping in the literature and found there wasn't a lot explaining and going into depth about hiking and camping risks for specifically for children with autism, but there were a lot about children in general. The little bit that we found, though, is that there are many benefits for children, and especially children with autism, because there are more risks associated, but they can also include hazards like falls, getting lost, scrapes, burns, and insect bites that are also there for typically developing children. However, these are also really good activities for families and children with autism because, one, hiking is most often free, and it can be done leisurely, or it can be physically demanding if you want it to be. You can also do it routinely if that's what your child needs, or it can be done also in socially or in large groups. So you can include that social aspect to it if you'd like to. Same with camping, similarly. Camping is also a great way to expose your child to the outdoors while also having a shelter and a safe space around. But they do include risks, especially with animals and weather. So it's important to be prepared and plan for all of the scenarios possible. So have the correct equipment, be prepared for all types of weather, and make sure to teach your kids and about animal encounters and prepare for those just in case. And for camping especially, it's important to memorize the campsite number in case anyone gets lost, as well as bring food and activities that are preferred by your child, so they will eat on the trip. Thank you. Next slide. I'll turn it over to Paige now to talk about swimming and water safety.
Thank you. So through our literature review, it was found that there are many benefits to swimming and water play for children with autism spectrum disorder. Swimming was found to be the most preferred activity for children with ASD. This is likely due to the low social demands and repetitive movements, as well as consistent sensory input due to the qualities of the water, such as consistent temperature, buoyancy, viscosity, density, and resistance. Aquatic therapists have seen improvements in underlying skills such as strength and balance, which also translate to other domains of life, as well as increased social participation in water activities as a family. However, there are also risks associated with water, such as unintentional drowning associated with elopement, which is running away, was reported as the leading cause of death in children with autism spectrum disorder under the age of 14 in the United States. Next slide, please. For prevention strategies, the most effective strategy that has been found is to enroll the child in swimming lessons that have autism-specific elements. And however, there are many barriers to accessing these swimming lessons, such as lack of trained staff with expertise to work with those with autism spectrum disorder. Different strategies to encourage an effective swimming lesson could be to pair a preferred activity with a new instructor to help develop rapport and trust. Other ways to increase support in swimming lessons include visual schedules, gaining attention before beginning, discrete trial teaching, and others. Instructors should also focus on giving task-specific feedback, such as most to least prompting, shaping, and reinforcing. In the community, it has been found that teaching water safety to children has been best done by including reinforcement systems, behavior management, and individual component teaching. However, this often requires a lot of clinical skill and experience. Other water safety strategies include encouraging swimming skills and survival swimming. Next slide, please. We have created an example website page for you guys to look at. So this is the one on swimming and water safety. It includes the 4 different subheadings: benefits, risks, how to find effective swimming lessons, and enforcing water safety in the community and family. There will also be a homepage and other pages that look similar to this for the other topics discussed, as well as links to other resources such as training courses, swimming lesson website links, etc. Next slide. So our next steps are to work with a web designer and consult on an overall design plan, incorporating features that were indicated through the survey results as important to service providers and parents. We will then further develop content for the 4 to 5 more sports topics and 3 to 4 more behavior management topics guided by our survey. After this, we will pilot test with end users a version of the website to be able to conduct a more informed revisions on what works and what doesn't. And then we will evaluate it again. And in the future, we'll also plan for the sustainability of the website. Next slide. Web-based strategies hold promise as an effective way for parents to easily access evidence-based resources to support safe recreation participation for their children living with autism spectrum disorder. Through obtaining this end user input, this will help us to maximize the relevance of the content to meet the parent and service provider needs. This project supports the reduction of inequalities through promoting safe recreation participation and inclusion for families and children on the autism spectrum. Thank you. I will now pass it back to Lise.
Thanks so much, Paige, and thank you to both of Rebecca and Paige for all of the work they've done in the past few months, summarizing some of that very valuable information around swimming and the outdoor activities and your contributions to the project. So there are some references that we're happy to share further if anybody would like these details. That those will be available, and also just an acknowledgement to the broader team, the other co-investigators that have been involved in this project from UBC Okanagan, as well as Simon Fraser University and the School of Population and Public Health at UBC. So that's Dr. Bersoni from UBC, Dr. Gracie Aroki from SFU, and then Drs. Rochelle Hull and Ellie McManus from UBC Okanagan, and Carolyn Zostak, who's from psychology at UBC Okanagan, who co-supervised Paige and Rebecca as part of the MRF program. And we've also had other students involved in the project over the last while. So Crystal Shannon, a graduate student, and Katie Belhowski, an undergrad student, and Sarah Lee, a volunteer who's worked with us on the environmental scan. And also a thank you to the funders, to SHRC, as well as the MRF program, and for supporting Rebecca and Paige's involvement in this project. We've also had a number of several community collaborators involved, and so a big thank you to the Canucks Autism Network and Autism BC, as well as Autism Community Training. So thank you very much for your attention. We're happy to take any questions, and happy to discuss any further details. If you'd like to get in contact with me, email or phone, and I'd be happy to talk to anybody about any further questions. So thanks so much.
Thank you. Thank you all. That was really informative. Great presentation. So for our participants today, I'd encourage you to type any comments or questions you have in the chat box, and maybe I'll start it off. Delighted to hear about this. And I guess one of the questions I had was, in terms of the people who responded to the survey, particularly the parents, I'm wondering if those were all mothers or women, and as well with the service providers, and if you think that might make any difference to your results.
For the parents who responded to the survey, there were 2 dads. Mm-hmm. So there was some representation of fathers in there, but otherwise mostly mothers. And the service providers, I don't actually know. I'd have to go back into the survey and double check that. But yeah, I think that's a good point, and that there might be some, there might be some differences in the kinds of activities that parents, either mothers or fathers, might want to help their children become involved with, and the ways that they might want to assist them with managing risks. So I think it's an interesting thing for us to think about as we move forward as well, in supporting, both moms and dads in terms of their helping their kids.
And so the service providers, can you tell us a little bit more about who they were? Were they like teachers or recreation people or daycare people, or?
They were mostly coaches and recreation instructors. Yeah, so coaches working in different recreation programs, but there was a mix. So there was also a couple of teachers, a couple of daycare providers, and therapists as well. So often children on the spectrum may have a therapist who works with them on a continuing basis and might take them out to do various activities in the community. So
Right.
there was a mix, but mostly program instructors.
Yeah, that's great. That's good to hear.
Yeah.
There's a question about wondering if you might put the contact for the survey in the chat box, or for people who are interested in completing the survey, should they contact you directly, or what's that?
Yes, please just send me an email and I'll send you the direct link to the survey.
Okay.
Yeah.
So Lisa's contact info is up there, both an email address and a phone number. So yeah, if you know people who are interested in completing the survey, or if you are interested in completing the survey, do reach out. It sounds like the team would welcome some more feedback if people are interested in helping out. So that would be
Absolutely. Yeah, just a quick note, and say I'm interested in the survey, then I can just send you the link.
Great. So another question I have in the meantime is, one of the things I thought was really interesting is that videos and blogs were highly rated, which, kind of in some ways fits with what I've been hearing and seeing. People really like Instagram kind of videos, those little quick, short videos, not long ones, just quick, short ones. So I'm wondering if Rebecca and Paige have any ideas about how videos might be integrated into helping people figure out hiking and camping safety, and also swimming and water safety. And maybe we could start with Rebecca. What do you think?
Sure, that's a great question. I think we actually talked about how we were going to incorporate videos onto our website the other day. I think it could be included in a variety of types, specifically for hiking and camping, maybe a video about tips on what to do if you interact with animals, or a packing list, and you could have someone, packing their bag and showing you what it is to bring, because that could just be better, more accessible than reading it. As well as just including tips. When I think of videos on a website, I always think of like news videos where they have the information in a video and then you can like read the exact what they're saying afterwards, which is funny. So it could also be something like that. But that's something we're going to talk to the web designer about.
Yeah, they probably have some ideas about that. What do you think about swimming and safety, Paige?
I think for swimming and safety, it could be very useful to potentially show the things I'm talking, or the things we mentioned on the website, in action. So showing maybe how a behavior support plan created by a professional could be implemented, or showing different modification strategies to an environment that you could make to be more helpful, because I think having a visual is always very beneficial, because sometimes when you're reading a whole chunk of information, you definitely get lost in it. So that might be why some people might prefer the video aspect. And yeah.
So just have the video done at the pool or something.
Yeah, you can do it at the pool or at the home, if there's a body of water nearby, in terms of the water safety aspect.
Yeah. One of the things that we found in some of our work is that the voice of other parents can be very powerful, who've had the experience of integrating and implementing these kind of activities, in this case to protect children and keep them safe. So that might be interesting to think about, finding parents who are pretty good at this already, or have some experience, who might be able to share it just in a really quick video.
Yeah, I think that's a great point, Joan. And, back to your previous point as well, to have some videos showing perhaps moms and dads out there doing activities that perhaps families haven't really thought of as being feasible for them, but if they can see some other parents out there and doing it help
great idea.
Increase their own confidence, perhaps.
Absolutely. Great.
Yeah.
Great. I wasn't sure about the blogs. Like, who would be writing the blogs, or what kind of blogs you think parents might be interested in? Because that was also highly rated. Have you any ideas about that, Lisa?
Well, I've seen some blogs. One example is Autism BC has a section on there. They have quite a newly designed website, and there's a section on it that has blogs, so just stories by parents about their experiences. And there was actually one, I think it was from some months ago, but it was a blog describing an experience, a parent's experience with a child who had tended to elope and wander, and how hard that was and what they did to manage it. So I've seen some examples that might be, you know, good models to use if that's what, you know, people are interested in. You know, I mean, it's interesting. I think we're kind of getting two kinds of information from these responses. One is that, you know, respondents are really valuing like reliable information from solid sources, at the same time wanting to hear about real experience that other families and parents have. So there's kind of that that dual need.
Yeah.
That it's not just, you know, information from research articles that summarize, that it also needs to be engaging and inviting material that people want to listen to or watch.
Yeah, yes, fair enough. I mean, it's one thing to know the facts or the best evidence. It's another thing to think about actually how you put it into practice. And so the two could be very complementary, actually, I think.
And the web designer, we have a group that operates out of BC Children's Hospital that is very part of their strategy. They really recommend using videos as much as you can, and they found that that's very, you know, that's a preferred format for many different users of websites. So we'll be working with them to figure that out and how we can do that with our budget that we have available.
Well, these days it doesn't take much to create a video, so you can almost do it with your phone. But I realize at the same time we want them to actually look a bit professional as well. So yeah, it does take a bit of time and resources, I admit, for sure. So I wondered as well, one of the things that we've found in some of our work is that, you know, people sometimes didn't want to read a whole bunch, but they wanted like the 5 quick takeaways or the 5 quick tips, or, you know, just give me the strategies. I know I need to keep my child safe in this case, so just give me the 5 top things to do in relation to whatever topic, hiking or swimming or whatever it might be. Has that ever come up in your discussions with parents or service providers, for that matter?
Well, I think I think it kind of depends a little bit, because I feel like when in discussions around if families are involved in particular sports, like if they're really very involved in soccer, for example, or they're really involved in skiing or swimming, I think that like those families that are looking for specific guidance to really help them with a specific activity, or cycling, I think they actually want quite a bit of information. They really want to know how to do it correctly, and you might want more detail. So there may be kind of 2 audiences, one that is more introductory, and that's a great thing to think about in terms of formatting the information, that there might be a need to have the kind of the quick synopsis. Here are the things to consider for people that are maybe just trying to suss out a few different options. What are they going to be most interested in? But there will be those people that really want some more detailed information. But that's also where we want to include links to other sites that can provide as well some more specifics. Like for swimming, for example, there's a lot of other websites that can really get into the specifics around swimming. Yeah, so I think there's a few different needs that we'll be trying to kind of balance. Yeah, because certainly some people may want to look at the website just to help them kind of figure out what might be a new activity to take on, whereas others might be very involved in a certain sport and looking for more in-depth info about that particular sport. So we'll have to balance that.
Yeah, fair enough. So I'm wondering, are there, and I'm assuming that this is covered, or you're thinking about covering this, but maybe you could speak about it. I guess I'm thinking about, beyond the action of the caregiver, whether that be parents or, daycare providers or coaches, are there the environmental changes that we need to also put in place, or to ensure that our community centers put in place, our playgrounds have in place, that would help parents, so it's not, or caregivers, it's not entirely on their shoulders?
Yeah, that's a really good point. I think that some of those decisions might fall at the municipal level, and maybe recreation departments within communities that take a look at their policies around inclusion and think about what they might need to add to make an environment safe. For example, if there is a playground, does it just need a fence around it so that parents can take their kids there and feel comfortable that they're not going to run off into the water? Like, I've been very kind of driving around the community, I've been paying attention to playgrounds, and especially in the Okanagan here, how close so many of them are to water. And there's really no barrier in between the equipment and the lake. So I think, that might be something to consider, looking at the municipal level. And I think another one that's really important, and this came through in Crystal Shannon's master's thesis work as well, is thinking about the need for some certification around, or training, even just consistency in training for sport and rec leaders and coaches, so that there is a kind of a training course or something that they can take, so parents can feel confident that coach or recreation leader that's supervising their child for the afternoon or for a couple of hours, that they can feel confident that they have some background in how to keep that child safe, rather than if it's somebody that just doesn't, has received just a small amount of training, or is not as aware. So some consistency around policies for training for sport leaders, I think is important. Paige, I don't know if you want to add anything to that comment around like swimming, because Paige is a swimming instructor and has worked with children on the spectrum. And so you may have a little bit to offer around training and what that looks like from a swimming perspective.
Yeah, I think the training component is a really, really big thing. I think there needs to be more training for specifically in swimming to help teach autism specific swimming lessons, because I've taught both just in a recreation setting, just a full swimming lesson, and then I've taught also with Canucks Autism Network through swimming lessons, and the difference in the way that you teach is very different. I think it's also very important to acknowledge that maybe using visuals in a swimming lesson would be really important, not just to benefit the children with autism, but also other children, because there are visual learners out there. So maybe incorporating in the swimming training use of visuals or visual like demonstrations and stuff like that, and using more of the modeling and more of the accessible different strategies could definitely help in just like for children with autism to access recreation through the recreational system, and also other children as well.
And there's actually a big transition going on, and Paige, you might want to speak to this as well. There's a big transition going on in swimming lessons right now, with the Red Cross not moving away from swimming lessons, and that it being transferred, these functions being transferred to the Royal LifeSaving Society. And so the training for coaches and swimming instructors for inclusive swimming lessons, there might be an opportunity as this moves to solely to a different organization to look at, how that training is provided and what's required for swimming instructors.
Yeah, LifeSaving Society is taking over swimming now because the Red Cross has decided to focus on other humanitarian needs like the pandemic and the opioid crisis and stuff like that. So they're shifting their resources towards that. And LifeSaving Society is taking over all of swimming lessons, which will be interesting to see. We're currently all transitioning over. So it's going to be interesting to see how the adaptive curriculum from Red Cross gets transferred over into LifeSaving Society and if that gets implemented more throughout the structure into more of just like general swimming lessons instead of having a separate adaptive curriculum versus a just a general curriculum. And yeah, it's going to be an interesting transition. It'll be interesting to see how they fully integrate it all. It's very new. I think the Red Cross is officially done on January 1st of next year. It's officially out of swimming lessons, so they're transferring everyone over right now.
That might be a good blog for the website to introduce those changes. Well, this has been really an interesting discussion, and I know if people are interested either in completing the survey or in helping in future parts of this ongoing project, that they should obviously be in touch with you, Lise. There will be opportunities, if not now, in the future, and so I'm sure that you'll be happy to hear from people. This session has been recorded, so it'll be up on our YouTube website. And so people can pass on the link to other people, and your contact information is here. So hopefully you'll hear from some people in the near future who are interested in working with you. So given that, and I don't see any other questions or comments in the chat, I want to maybe close by thanking you, all three of you, for this great presentation and wonderful conversation about how to keep children safe, particularly those children with autism, and wish you well in completing this project and look forward to future updates. And particularly to Paige and Rebecca, all the best in completing the last month of your program here at UBC, and all the best wherever your career takes you from here. And hopefully we might see you again at UBC to do some graduate work in the future. So in closing as well, I just want to thank everyone who joined us today as well, and hope that you may be able to join us for future sessions that are offered by the Institute for Healthy Living and Chronic Disease Prevention. So with that, I'll say goodbye.